Oh, I'm live. Look at that. I did it. There were some serious doubts about my abilities, rightfully so. Hi, everybody. Good evening. Thanks for joining us. This is Natasha Harper-Madison coming to you live from my bedroom on this early April evening. I'm the proud city council member representing District 1 in East Austin. Sharing some information with you this evening because it's important. Thank you guys for joining us tonight. Another night of a community in crisis, frankly. So during a time like this, accurate, current information is absolutely vital. So being aware of the challenges that we're facing and the resources that are available to help us face them, that's essential to keeping Austin safe, to keeping Austin healthy and resilient. Tonight, we're going to talk about some of those challenges, and we're going to also talk about those resources, those very important resources. We're going to do it with several of our well-sourced experts this evening. Joining me for the community conversation will be Austin Public Health Director Stephanie Hayden, Sherelle Van Brockel from the People's Community Clinic, CEO of Survive to Thrive Foundation, Courtney Santana, Nefertiti Jackmon also is joining us from Neighborhood Housing and Community Development, specifically with the anti-displacement program. And Nefertiti actually has an especially time-sensitive message for us tonight about how to apply for the Emergency Rental Assistance Program through the City of Austin. It's called RENT, the acronym RENT. That deadline is tonight, so please stay tuned for details after we hear from Nefertiti. While we wait, and while folks are trickling in, I want to remind everyone that the City of Austin provides daily updates on COVID-19, on the COVID-19 pandemic on the City of Austin's website. The page contains data about the latest numbers of confirmed cases in Travis County, as well as resources for people struggling with housing and or unemployment. Find out all that information at www.austintexas.gov/COVID, that's COVID 19. And so I think we're ready. I'm pretty proud to bring up one of our first guests this evening, Director of Austin Public Health, Stephanie Hayden. She's a licensed master level social worker employed by the City of Austin. She has been employed with the city for 19 years. Stephanie has spent her career as a public servant, working in the fields of social services, and 26 years in management. And I don't see her on my screen yet, so there we go. Good evening, Director Hayden. Thanks for joining us.
Good evening. Thank you for the opportunity to be here. I'm really excited.
It's a pleasure. How are you?
I'm doing just fine, thank you.
Good. We've spoken at least 3 times today, and I think that's probably what it looks like, in the era of COVID, that we're all in pretty regular communication and just trying to stay on top of everything. And I've said it before publicly, and I'll say it again. We are so proud to have you at the helm and helping see us through this challenge. Your dedication and your commitment is obvious, and we really appreciate you. Thank you for joining us this evening.
Thank you very much.
So next up, joining us, we have Sherelle, and I know that I mispronounced your last name. I said Van Brockel, but I believe it's Van Brakel. So I'm going to have you clarify when you jump on. She's the Director of Health Promotions and Community Advocacy at the People's Community Clinic. This work focuses on upstream determinants that affect patients' health, both inside and outside of the clinic. Sherelle is also a part of the Dell Medical School's Community Strategy Team, very important, and is Commissioner on the African American Resource Advisory Commission for the City of Austin. Hi.
Hello, how are you guys?
Oh, doing well. How are you?
I'm doing well.
I'm glad you could join us this evening. Are you prepared to hand me my lashings for mispronouncing your last name?
No, you actually got it really well. It's Van Brakel.
I did it.
Yeah, you okay. Did. Go ahead, girl.
Thank you. How are you holding up?
I'm doing well, as long as I can keep my two girls from beating each other up behind my camera screen during every meeting. I think we'll make it through.
I was on a call today where there was a mom who looked over and the look of alarm on her face. And so it was clearly obvious. And so she shared with us that her 12-year-old was he was whittling a spear. And so.
Oh,
Yes, I understand. I had a 3-year-old birthday party for my daughter's bear at 1:00 today in the middle of my workday. As long as it keeps them sane, I'm going to do it.
Necessary things. We're all very fortunate to be able to keep working. I tell you that. So that's one thing I keep counting my blessings.
Definitely.
So hang tight. We're going to bring on a few more guests. Next up is Courtney Santana, the CEO of Survive to Thrive Foundation, whose mission is to provide resources and support victims of domestic violence and to empower them on a sustainable path to recovery. She's also an author, a speaker, and a member of the City of Austin's Human Rights Commission. Courtney, are you with us? If she's not here yet, I suspect she's coming.
No, I'm here.
Yay!
Hi.
Hi, how's it going?
Good. I'm trying to keep you from seeing all my laundry.
I can't see a thing. You
Okay,
did
good.
it. You got them angles right.
Right. I'm trying to figure it out. Yeah, I'm good. There you go.
Now you got it. Thanks for joining us this evening. How are you holding up?
Good. I too am trying to figure out how this, crisis is going to deal with our laundry issue. I've got 2 men in my house that, it's interesting being quarantined with 2 men.
Laundry's a thing. Well, at least they're keeping it interesting for you.
They are for sure.
Well, thank you for joining us, Courtney. I'm going to bring on our last guest for the evening, or our other guest for the evening. Nefertiti Jackmon serves as the program manager with Neighborhood Housing and Community Development for the City of Austin. She's spearheading their displacement prevention efforts. As the former executive director of Six Square, Austin's Black Cultural District, she brought passionate, eloquent, and visionary leadership to the development of projects that preserve, educate, and sustain Black arts, history, and culture in Central East Austin. Nefertiti, we're happy to have you with us.
Thanks, Natasha. Thanks for allowing me to join everyone this evening.
We appreciate you coming out. How are you holding up? Busier than ever?
Busier than I was in the office, believe it or not. But I think COVID made it that way. So this is a challenging time, but I'm peaceful. And I don't have some of the challenges that some of you, I have no young kids. My son is grown. So that's a thumbs up for me. I guess I started early, but I'm thankful. Everyone is safe.
Same. Yeah. And so, we want to thank you all for joining us and really want to appreciate your time and the time of the folks who decided to tune in with us this evening. And in large part, we have decided that, we're going to have to bring the information directly to the people who need it in a way that's beyond websites, that's beyond newsletters. And this is one of those ways. And so as we're moving through this crisis together as a community, I think it's really important to keep people updated about what's happening, who's doing the work, how they can be supported, and frankly, how they can be supportive. That's one of the things that we've had the opportunity to observe during the course of this crisis, is that the response from the community has been resounding. Everybody's showing up to do their part and see how they can just be a part of keeping everybody afloat. And then, for those who are able to do so, really just thinking through to what does our recovery effort look like and how can we start sowing those seeds now? So I'm going to just shoot around a couple of questions, no particular order. Whoever feels that the call in to answer it, if you wouldn't mind just, walking us through sort of, as you're answering the questions, also just sort of walk us through what are some of your challenges and how as a community, how can we support you? And the things that your organization is doing that you think is important for the community to know. So Courtney, I think I'm going to start with you. I know that we're working on some projects with Survive to Thrive, and that the city's going to be partnering with your organization to do some really important work around intimate partner violence. And I think, it might be helpful to sort of give the audience a little glimpse into not just the work that you generally do, but why it's so important right now and how much there is this sense of urgency for the work that you're providing.
Thank you so much. Yes, thank you. COVID-19 has presented problems for everyone, but interestingly enough, domestic violence victims are experiencing an intensified violence that they normally don't experience because of the shelter-in-place order that exists right now. You're taking an already violent home and you are forcing an abuser and a victim to be in close quarters pretty much all day, every day.
Right.
And there are other extenuating circumstances that come into play. There might be unemployment, there might be financial pressures, just the sheer uncertainty of the COVID-19 pandemic and the coronavirus is causing a lot of tension in homes. Therefore, we're seeing an uptick in domestic violence calls and an uptick in aggravated assault calls. Mm-hmm. So right now, the shelters are unable to meet that need because there's, they're trying to protect the health and safety of their current staff and of their current populations, but they're also leery of the fact that they can't really get new people in, not knowing who might be asymptomatic with the coronavirus and might be carrying, and then bring it into the shelter and create a hotbed. So these people are in limbo. And thank you to the City of Austin and the funding that we're about to receive. We'll be able to meet that need. So it's been an interesting month.
I can imagine.
Yeah.
Let me ask you, so what should a person do if they are quarantined and in an abusive situation? What does a way out look like for them? What information should they know? What steps should they follow?
Well, with right now, we've set up a 24/7 phone bank. They should call the police. They should definitely call the local shelters to see if there is, by chance, any space available, because that's what we refer to them first. Then after that, they can call our phone bank. Our phone bank will get them into a safety net of hotels. We've now built a safety net of about 15 hotels. It's about Yeah, we went from 5 2 weeks ago to now we have about 15 all around the city, where we can place these victims to help them to get food, but just to get out of that violent situation. And they'll be able to observe social distancing protocols and all of those things, so they won't be in an unfamiliar environment with unfamiliar people. So we're thankful to the City of Austin, to Austin Public Health, and to the RISE funding for enabling us to meet this need, because we've gotten a 200% uptick in calls.
Wow, that's really unfortunate, but I'm so glad that y'all are on the scene to meet the need.
Yes.
It's so important. And thank you for your service. We appreciate you. How can the general community support your efforts?
Well, we are still taking volunteers for the phone bank. We have drivers that will deliver food to the different places that we have. Right now, we have about 30 families that we are supporting in some way or form or fashion. And we expect that to go up. The longer that COVID, the shelter-in-place order is in order, the more calls we're getting. So we need volunteers. We also need donations. We need advocacy to let the folks know out in the general public that this resource is there. We've partnered with lots of organizations around the city. So just those 2 things: volunteering, donating, or 3 things, and advocating for our program.
Awesome. And I'm assuming they can find information at www.thrivefoundation.org.
Absolutely.
All right. And we threw that up in the comments. And if anybody has any questions after the live stream that didn't get answered, or you want to talk to one of the speakers, feel free to reach out to us. We're at District 1 at Austin, Texas, District 1, the number 1 at austintexas.gov. That's austintexas.gov. And then next up, we're gonna bring up Director Hayden to give us any updates you may have from the scene on Austin Public Health, and where more information can be found. Any updates that you might have, and any direction that you might be able to offer the community for how they can help this really massive, expansive effort that Austin Public Health is undertaking.
Thank you again for the opportunity. what we know now is we have 1,946 confirmed cases of COVID-19 in our community. And one of the things I always have said throughout the course of this response is that we have to keep in mind that I know we're using the terminology of case or cases, but these are individuals. And
Right.
so we cannot emphasize that, these are individuals, and we know that as we are working through this process and looking at the data, we know that 9% of the individuals that have tested positive are African American. We also know that 48% are Hispanic and 3% are Asian. So when we look at how disproportionate African Americans and Hispanics are in this population, we are concerned about that. We have, really been tracking the data throughout this process, and individuals would like to see the data that I am talking about. They can go to our COVID-19, our Austin, Texas.gov website, and that information is available and it is updated daily on our website, because we want to make sure to provide as much information as we can. In addition to that, we are looking at hospitalization data, and that data is not owned by Austin Public Health, but it is shared with us to put the data on the website.
Mm-hmm.
So currently, of our 94 individuals that are inpatient, we've had 235 people that have been hospitalized.
Mm-hmm.
And 12% of those have been African American, 51% of those are Hispanic, and 3% are Asian. And so, as you can see, we are disproportionately represented in that system as well. And so, one of the things that is really important to us is that these health disparities and the discrepancies in the data is one of our top priorities. We know that this affects our entire community, and that's why testing is so important. We are really wanting folks to access this portal. If you go to the website, you can click on the link that says testing.
Mm-hmm.
If you have questions and you don't have access to the website, we encourage you to call 311, and then we can get you some assistance there. But we really want to be able to get people to come in to have their tests. We've made some changes to the algorithm, because what we were noticing is that we are not getting enough of the people in that we want to test. So we made some changes to the algorithm. And so our hope is that we will be able to get more people in to test. The other thing that we've stood up early on in this process, the social services branch. And it's key to have that social service branch up and running, because we want to make sure that we are doing everything we can in this space to look out for our vulnerable populations. So from seniors to people with disabilities, to formerly incarcerated people, to their family members, just across the gamut, and that's just to name a few. And so within those, we've been working very closely with our equity team, because we want to make sure that the services that are being provided, we're using an equity lens to provide those services. We want to make sure that they are culturally and linguistically appropriate services that are being provided. We are starting to look closely at where we have been marketing. And so we are going to make some adjustments because it's going to be key for us to get those messages out in ways, whether it's traditional and non-traditional ways, because we want to reach populations we've not been able to reach.
Mm-hmm.
So ultimately, I just recommend to folks that, at this time, as things are, are opening up and, more movement is happening. I understand, some people will need to go back to work. And I just, encourage you, if you're sick, stay home.
Yes.
If you don't have to be out, don't be out. It is so important for us to really maintain and not overwhelm our systems, because what we don't want to see is that we don't want to see such a spike of new cases that our systems are unable to handle them. So it's going to be really important that, folks are, washing their hands and coughing into their sleeves and wearing their mask. It's not, or face covering is not required, but we recommend it. I think it's a good idea, because this is a respiratory infectious disease. And so we want everyone to really exercise as much caution as you can. But lastly, we're also concerned about our mental health. As a community, we know it's so important for us to think about total health, our physical and our mental health. And
Mm-hmm.
it's so important for us to do those things that we need to do ourselves mentally and physically healthy. And so as if we're feeling depressed, we're maybe being inside too much or just feeling overwhelmed, Integral Care has been really instrumental in providing that helpline where
Mm-hmm.
you can have those conversations for free, and they'll be able to do some counseling with you. And so we really encourage that, to find a really safe place to be able to express how you're feeling. We are encouraging physical activity. It's still a good thing to get out, take a nice walk, and drink plenty of water, and do the things that you can do to keep yourself healthy. And so those are just a few messages that I have. And I just want everyone to know that your health and safety is our top priority for this community. And thank you again for the opportunity to be here this evening.
Absolutely. I really appreciate, I know you've had a long day. So I really appreciate you sticking it out with us. You said something that I think is pretty important to highlight. You said the thing about face coverings, how it's not required. So I certainly don't want to poke the bear, but I do believe that folks are a little confused about mixed messages. They're getting certain messages from our governor and then other messages from our mayor, and they're just not quite sure whose message to follow. So I really appreciate that you gave the caveat that it's not required, but it's helpful. It's helpful to you. It's helpful to your neighbors. And so, that I think exercising an abundance of caution shouldn't be a requirement so much as our obligation as members of a community. So thank you for pointing that out. And I really appreciate you pointing out the part about it, people maintaining their mental health and wellness as well. I know that I read a statistic about folks having more difficulty maintaining sobriety during this time, and there being an uptick in substance use episodes. And so I just wonder if you have any advice for where folks can go in a way that's, let's say they're there's a meeting that they normally go to, but that meeting isn't happening because that rec center is closed. I've been thinking along those lines and reading some things along those lines, and just wondering if you have advice for folks who are struggling with substance use disorder, if there's any particular resources that we have available for them. And, and if that's not a question you can answer off the top of your head, if that's something that I can share with them later, I'm happy to do that as well.
Okay, I will definitely get that information back to you.
Awesome, thank you. And we'll just make sure that
important.
Yes, and we'll make sure we're listing that in the resources. So, like I asked everybody else, how can we help you? What can we, other than maintaining the abundance of caution you made reference to, and doing what we need to do for our individual selves and our families, or what can we do to help? Are there, like Courtney said, about there being opportunities for volunteering? Is that something that Austin Public Health could benefit from, or how can the general public help?
Those things that you mentioned are very important.
Okay.
As we have folks to take that individual responsibility just to do better for me and my family, that will help me so much. And it will also help you and your family as well. But the other thing is get word out about the testing opportunities. We really want more people, African Americans and Hispanics. I know we are disproportionately represented, but we need to know our status.
Yes.
We need to know. Now we're noticing that some folks are asymptomatic. We need to know our status. So by all means, get the test and know your status.
Absolutely. And I think we just got some breaking news in our nightly update. The number of confirmed cases in Travis County has risen to 1,946. That's 70 more cases than we had yesterday. So the concern is clearly not reducing, it's increasing. And so, everybody that has any questions about how you can help get the word out, Director Hayden, some communities that we've been leaning on are faith-based communities and various other social services organizations to help get the word out. But I know that Austin Public Health, my office, the city at large, we're all, sort of trying to put together these systems for real comprehensive direct outreach efforts. And so we just want to say thank you for all that y'all are doing on that front, and really hope that the general community can help dial in to helping to conquer some of the disparity. Because I do believe, honestly, that oftentimes it's just a matter of the information not getting to the people who need it the most.
I agree. And that's why we have to do better. So absolutely.
Thank you so much. I appreciate it.
Thank you again for the opportunity. I appreciate
Absolutely.
it. Okay.
I suspect we'll be talking more soon.
Absolutely. We sure will.
Yes, ma'am. Thank you. So next up, we're gonna.
Thanks for all you do. I say thanks for all you do for us in this community.
Oh, thank you.
Yes. Yeah.
It has been a challenge, but it's been the most fulfilling challenge I've ever had to face. And so my hope is that at the end of the day, we are just able to help people get through. So we're gonna keep moving in the direction of health and wellness. I'd really like to bring up Sherelle from People's Community Clinic next. I know I was just amazed when I had the opportunity to visit y'all's facility. I was just amazed at how many services y'all offer, and how comprehensive the services are. And, when we went to the room where, I got to see where you're able to offer period products and help people through that. I in addition to what y'all always do, what are things looking like for People's Community Clinic and adapting during this difficult time?
So, of course, thanks for having me on. I'm really excited to be able to talk about this work that our clinic is doing. And I mean, I commend our clinical staff for the effort and the hard work that they're putting in every day. For a couple of weeks, everything kind of just stopped, and we stood up. Sorry, 2-year-old's mad.
That's okay.
We stood up telehealth medicine in about 2.5 weeks, which is something that takes multiple years to do, so that we'd be able to continue to see patients around things that are not necessary for them to come in, but we're able to still have those conversations with them. My team, once we kind of settled in understanding the best way for us to see patients, my team has really done a lot, and we've halted a lot of our work to just provide wraparound services for our patients. And so when we have a patient that comes in the clinic, and they are homeless, or they don't have food, or they don't have transportation to get to the place that they need, or the medicine that they need, my team we just go through all of the resources that are available and have conversations with the social service organizations who have been amazing through all of this to help get our patients what they need right then and there. So we had, so a lot of times we're kind of just like on teams, like, all right, what about this food pantry? This is kind of close to the patient's house, and just kind of helping the nurse. A lot of the patients are in there in the clinic with them, and it's not ideal for them to be able to stop and do a lot of that resource navigation for the patient. And so that's where my team comes in. And the social service organizations and the people that we've been talking to have been so great and so helpful, and are calling me back on my cell phone to give me updates about stuff for patients. And our community health workers have just gone above and beyond to be able to just get people food. We actually have been doing a lot of applications for direct funds for our patients, because in the conversations, a lot of people just need money to get the things that they need. And so rather than have any say of what they are able to do with the money, we're just kind of helping them get those direct funds so that they're able to get all of the stuff that they need to stay healthy, whether that's pay their bills, get food, or have money for transportation.
I had some tech difficulties. I appreciate all of that. How can, I see it now. So www.austinpcc.org. Is that the best way for folks to contact y'all if they have questions or concerns?
Yes. So when you go to our website right now, there's actually a COVID pop-up that comes up for you to get all of the FAQs that we're getting in. So how to have visits, about our telemed technology. There's lists to all of the resources that have been gathered. We are sending people to use the Aunt Bertha platform. We are sending folks to use 211. We're sending folks to Austin Public Health has a great documents that's kind of has all of the resources available, and our staff are using that to navigate resources. And then we're also giving those resources to our patients. So thank you to all of the different community groups who gathered all of those resources. Because it's super, super helpful to folks like myself and my team.
And just to be clear, when you say the Aunt Bertha platform, I actually just found out about this resource. It is amazing. You're talking about the findhelp.org platform?
Yeah. So the platform itself, it actually powers a lot of different websites. And so we actually have an internal site that we can use to navigate the resources, but Aunt Bertha is the platform. And so if you go to the Aunt Bertha website, you can search just like you can findhelp.org or connectatx.org. They're all powered by Aunt Bertha. And so it's a lot of 211 data, and it's updated constantly. So
yeah, I went clicking around through it yesterday. I followed the findhelp.org. I entered my zip code, and it was just amazing how comprehensive it is. So I really hope that that's a resource that people start tapping into, and really looking forward to the city figuring out how we can partner with some of that really comprehensive assistance and resources. So yeah, that's amazing.
And United Way are doing an amazing job of getting all of the resources together for us to utilize.
Absolutely. Are there any resources that you're aware of that we should share with folks listening in tonight that we maybe haven't discussed yet? Or I'm talking specifically, and maybe I'll be more granular. I'm talking specifically about like some of the things that I was amazed that y'all offer in terms of, having people maintain their mental health, having access to hygiene products and diapers and these kinds of things that folks need all the time, but probably especially now. Are there any resources you can share now, or could you share some with us later for us to share with our audience?
I can share some with you guys later. We've been using the Austin Public Health Google Doc and the On Birth, the platform, in 211 mostly.
Okay.
And it's really just been, on the hold with Medicaid or whoever else we need to be on, but I'll definitely send some your way.
Awesome. Thank you. We really appreciate you being on tonight, and just look forward to being able to answer folks' questions about Austin Public Health or People's Community Clinic. So glad that we have that resource in our community. Did I see correctly that y'all were able to receive some funding through the CARES Act?
Yes.
Awesome.
Yes.
That's fantastic. I'm really happy to see that the funds that organizations that are doing the work need are really making their way. If you wouldn't mind sticking around for a little bit, I might ask y'all a few more questions, but I'm going to bring Nefertiti up now. Thanks again for joining us.
Of course.
Awesome. Are you there? Hi there. I think you might be muted.
I am. I heard some background noise, so I didn't want to add to that. Sorry. Thank you.
No worries. Thank you for joining us. We really appreciate having you. I'm amazed at how our professional relationship has come full circle. From the
I am too. This is exciting. It's been an exciting journey, I think, for both of us, and I'm excited to see you where you are and thriving and making many contributions, continued contributions to the community. Absolutely. So thank you.
Thank you. And I'd say I'm rubber, you're glue. Whatever you say to me goes right back to you. Because I mean, you're out here doing this work, and like I mentioned earlier, you have the work of trying to prevent displacement. I mean, we were already struggling with the implications of communities being displaced prior to this epidemic, and so I and everybody is probably on pins and needles, really worried about, what it's going to look like moving forward when that it was described to me by one of the homelessness advocates yesterday as a tsunami of housing insecurity that's coming our way. And so just really wanting to find out more about what you're doing with neighborhood housing and community development and the displacement program, and how we can be supportive, and what information we need to make sure we're sharing with folks.
Absolutely. Thank you. What I will say, that the work around displacement mitigation is extremely important, and we were thankful to receive funding from the Housing Trust Fund to really put some there were some action items, but there was no one really dedicated to getting the work done. So everyone was doing the what they could and wearing many hats. But I did begin working on sharing the strategies and beginning to implement the strategies. And I will say then COVID came. And so, to be honest, the last, since we've been home as of March 18th, my focus has been on rental assistance, making sure people who have been impacted, who have lost their jobs, family members have lost their jobs, are able to remain in the safe space in their homes. What I will say before I begin to talk about some of the assistance that we're providing right now is, I think what COVID did, it really exposed the huge disparities that we have. There's many more vulnerable communities than we realized. And so, but I think what's most exciting, and I hope that government leaders, city leaders will realize that we are more nimble and can be more nimble than we ever have before. So I think before, we were in these boxes that we couldn't do certain things, but the response both by the government to respond to allocate funding, and I'll just give you an idea. So we had a contract that went out right before COVID. It was for $750,000 for organizations, nonprofit organizations, to help us with our tenant stabilization program, right?
Mhm.
But as a direct response to COVID, and I'm going to say the scale of need is, there's certainly not enough resources, but within 2 weeks, we were able to allocate $1.2 million for rental assistance.
Wow.
So, you know, and even there, we cannot help all of the families that are experiencing trouble paying their rent, but this is a huge start. And the funding for the rent, which I'll talk about, that came quicker than the contract that we had out. So I hope that going forward, that if no other department, but I've seen this not only in Austin, across the nations, governments are responding, and they're responding because the needs are impacting. Our failure to respond will have a devastating impact on absolutely everybody. But we need to keep that in mind in the future. I don't think things will ever return to normal, but we need to see that we can be compassionate and we can put resources to help people in vulnerable spaces. But just briefly, the rent program is relief of emergency needs for tenants. And one of the reasons why I am glad to share this tonight is because this program, it's a lottery system. It ends tonight at 11:59 p.m. Individuals can call 512-400-4275, and that's 512-400-4275 if you don't have access to the internet. So you can get information by texting or calling. And then thank you very much for putting the website up. That website, austintexas.gov/rent, will get you information to the rental assistance, the rent program that's available. I definitely want to applaud City Council and Mayor Adler for their efforts and making sure that we're able to get some of this assistance out there to the public. This is a pilot program, and I think one of the beautiful things about this is we're collecting data now, so we'll have a better idea of the scale of need that exists in our community. So that's one thing, and I'll stop there.
Well, I appreciate all of that. It's all very, very important. And I'm really grateful that, I was able to even be a small part in us, finding the resources to offer people the immediate assistance that they need. And I really look forward to us being able to work together moving forward to sort of to mitigate some of that additional displacement and housing insecurity that this kind of devastating economic situation could lead us to. So
Absolutely.
yes, ma'am. Thank you. So we're going to open the floor now and take some questions from the audience. Don't rely exclusively on my technical skills, everybody. Okay. So I'm looking at our chat. I'm guessing that's where the questions will come in. Okay. I'm not seeing any so far. Oh, okay. Okay. It looks like we answered that one. Miss Brenda Malik asked a question. She says, what about those essential workers? Especially, and before I really get into the question, let me just ask my team, can y'all get everybody, is it possible to have all the participants on the screen simultaneously? And then that way the appropriate person can field the question. All right, here we go. Excellent. Okay, so the question is, what about those essential workers, especially in government, city, county, or state? Can't we have a referendum policy to test those employees before returning to work? So many Black and Brown citizens are a part of these populations. I could speak to some of this to some degree, but I think Director Hayden, you might be the best person to field this one because it's specifically asking about testing, and I know that has presented some challenges for us. Director Hayden, are you still here?
Yes, I'm here.
Oh, okay. Yeah. I was hoping you could field this question since it's specific to testing, and I know that that's been one of our challenges as a community.
So I will say that Austin Public Health cannot set policy. Policy has to be set
Right.
by our elected officials. However, with the testing site, if you are a city or a county employee, you can go to the testing site and you can click if you have any symptoms, but make sure you work your way through that assessment. And so put that in, and if you're a city or a county employee, you can do the assessment, but then you could schedule your time to go over and take the test. At this time, we are just making sure that if you are a city or a county employee, we're plugging you into the essential first responders. If you're not at a point where your work that you will be doing falls up under a first responder, then we encourage you to take the assessment through the portal. So you can do that now if you would like. So I just want to make sure that folks are clear about that you can go through the portal and take that assessment if you're not a city or a county or essential worker right now in this space.
And I guess from the policy perspective there, Ms. Malik, I have a difficult time seeing how we can produce policy, but we can certainly offer direction. And it seems to me as though we're moving in that direction as it stands. But if there are other questions, or if you want me to go deeper into sort of the hesitation around creating a policy around having essential workers tested outside of what already is in place, and you guys, everybody on the feed, make sure to remember if you have any questions, if you'd like to volunteer, if we didn't answer your question this evening, if you have concerns that haven't been addressed, feel free to reach out to us at District 1. That's District 1, the number 1 at austintexas.gov. I'm going to move down to another question. Vicki asks, what's one small piece of knowledge about COVID-19 and your organization's response that you didn't think most residents are, or that you don't rather think most residents are aware of yet? And anybody who'd like to can field this one.
Can you repeat the question? I'm sorry.
No, it's okay.
I see it.
I noticed that the general population doesn't understand that abusers will use pretty much any tactic they can to control the victim in their home. I have folks who are, their abuser will allow them to buy groceries, or they control their spending habits, even down to using hand sanitizer. I believe Crystal Justice with the National Domestic Violence Hotline was talking about how that's one of the number one stated reasons for abuse right now is COVID-19. Literally, folks are using it as a weapon against other victims of abuse. So anything, to maintain power and control of their home, that's something that we don't experience in general population, but so many survivors and victims are dealing with it right now.
I appreciate that.
Yeah, I'd like to also add that some of the community-based organizations that deal with housing issues, they have seen a substantial increase in calls because landlords, in spite of whatever ordinance is out there, landlords are still threatening eviction. And people who are vulnerable under normal circumstances, things like this, they're amplified, as Courtney has been saying, they're amplified during a health pandemic like this. And so one of the things that we have been doing, as well as the community-based organization, including FOSTA, Austin's Tenants Council, is really making sure people are aware of what rights and protections that they do have. And I think that's that has been really heightened and brought to our attention, the need for information to educate tenants about the protections that they do have.
Thank you. I appreciate that.
I'd like to add just some information that may not be as common knowledge. I know that there's been some marketing strategies and medical companies that are marketing the antibody test for COVID-19. And so in theory, most folks think, well, you know, I should go and have this antibody test. And some folks are paying like $150 to have that test. Mm-hmm. And so there's about 90 tests that are on the market, but very few have received what's called emergency use authorization from the FDA. And so the problem with that is that it can be very inaccurate, giving a false negative result in people who have known to have had the virus. So we encourage folks, an antibody test is not a good screen for the current or recent infection. We encourage people to take a test either through a testing location like we have or through your physician's office. So we do not encourage at this time folks to take an antibody test. So I just want to say that to our public.
That's really good information. And we have several other questions, but we're right at about time. So I just want to encourage everybody who submitted a question to check on. I'm going to respond to the questions on the. I'm not sure where these show up, either in the event or if there's a Facebook Live where they show the video later. I can go back and I will personally go back and answer as many questions as I'm able to. And I encourage our guests on the line tonight to go back and review the questions. And if there's any information that you'd like to impart on the presenter of the question, feel free to chime in as well. We want to make sure that we get all these questions answered. I think so. This one about testing for retirees, I'm not sure exactly what's being asked there, Ms. Ursula. So I'll circle back with you and figure out that question. This is a good one from Kimberly. How can we get COVID-19 survival kits to 65 or older, people of color, lower income, with information, a thermometer, oxygen meter, Tylenol, and info on clinic and testing? Or is this happening with any orgs? I can answer part of that. I know that there are several organizations that have sort of compartmentalized groups of people around town that they serve. And I know that there are some organizations that are making phone calls and making deliveries and doing that needs assessment on the ground. So I don't know that it looks like a blanket distribution of these kits per se, but there certainly are folks who are addressing the immediate need of our elder community, people of color, and lower income communities, all who are obviously at higher risk. Stephanie or Sherelle, did you have anything to add to that?
Not really. We've just, for our patients who test positive, we have been offering that type of wraparound services with like Good Apple or food delivery and prescription delivery, but it hasn't been one thing lumped together. It's been us grabbing services from a bunch of different organizations and social service groups.
I will tell you that the city of Austin, and I'll make sure to get this to Council Harper-Madison is the city of Austin has a in the health department, we have an individual that works with seniors, and she provides, her name is Tabitha Taylor. And so I could give her information to anyone, but she is working with several groups, and she is in the know of what's happening with our senior community and providing those services. And so she's a part of our social services branch. Let me answer just two quick of these questions so you won't have to come back to them. As far as the retirees, what I would recommend is the retirees go through that portal and just do that assessment, and you should be able to get tested that way. And then,
that portal is at the COVID-19 page, correct?
Yes. At our website, our austintexas.gov/COVID-19. Absolutely, that's it. Yes. And then there was a question about the percentage of African Americans. It's 9% of the confirmed COVID-19 cases, and then it's 12% for hospitalizations. And so I just wanted to provide that again.
Thank you very much. I appreciate that. I hope that answers the question, Ms. Brenda, for Pat. And looks like our last question, did I personally share the city's messaging when it comes to housing and food vulnerability and resources, and also about the uptick in physical abuse to remind people that home is not always a safe place, right? What else should I let people know about? So if you're covering housing security, food security, other resources, intimate partner violence.
I do have a comment about that. I'm working with Judge Dimple in County Court 4 for protective orders. Many people think that they are not open right now, but the court, that particular court for protective orders is still open, and she's very much wanting to serve the community because she knows of this issue with domestic violence and intimate partner violence going up during this time. So if they want to message me, I can get them more information about how they can get protective orders during this time.
Thank you very much. And the message would go to website or email?
Email. If they want to send an email, it would be info@survivetothrivefoundation.org. And I'm actually going to be doing a talk with Judge Dimple tomorrow to talk about, legal issues during the COVID-19 pandemic and how they can get them addressed, specifically protective orders.
Great. Is that a public talk or is that
Yeah, it's public. It's her town hall, I believe. She does one every Thursday. So
okay.
I hope people
we'll
come.
find that information and share it.
Great. I'll send it over to you. Thank you.
Awesome. Thank you. Well, y'all, we've kept you a little longer than we anticipated. If you can bear with us just for a couple more minutes, I'm going to do a live fire round for our guests, and anybody can answer the question. How many telemeetings have you had in your pajamas?
Oh, in our pajamas.
Counting this one?
Oh yeah.
Well, I put up real bad for this one.
Oh my goodness.
4 or 5.
Well, thank you. I appreciate your candor. Especially because I believe everybody on the line is a parent. 30 years from now, what do you think we'll tell our kids and our grandkids about this moment in our history?
I've already decided to tell my daughter that this was like the worst kindergarten year ever.
Yeah.
We started kindergarten, which was already hard, and then her school was on the closing list, and then I was like, maybe spring semester will be better.
And then
welcome to kindergarten.
30 years from now, I'll tell my son that during this pandemic, he officially became my father. My son won't let me go anywhere. He's Mom, are you exposing us to COVID? And so he's very disciplined, and he's a young adult. I'm proud of him, but it's been a bit much for me.
all that extra oversight. I've given it some thought, and I've been journaling, which is something that I used to do a lot, and then you just get to that place in life where you're so busy and you have so much going on that you really forget to take that time for yourself to sort of get it all out. And so I've been journaling again, and that's been helpful. I think that's one of the things that I'll do for my kids is take some real time account of what's happening right now, because I think we take for granted that so much of what we do is on social media, and so there's some record of it somewhere. But we are, really taking responsibility for keeping record of what's happening in our lives. And so that's at least one of the things that I'm doing. I think the other thing that I was thinking about, like how to describe this period and time to them, in my mind's eye, I think Nefertiti, you might have said, we'll never go back to normal, whatever that was. I saw this really beautiful statement the other day, and the sentiment essentially, I couldn't quote it verbatim, but the sentiment essentially was, why would we want to go back to normal? Why would we want to go back to a normal that excluded people and there was a significant lapse in equity and compassion. And why would we want to go back to a normal where we have this much economic disparity that shining bright light that's shining on us now? Even just thinking through, a couple of our guests on the line tonight really highlighted it by way of, Nefertiti, I think you said, if you don't have digital access, you can call or text this number to get this service, or thinking through people's access to telemedicine. If broadband isn't looked at as a public service, a public good, everybody doesn't have access to it, then that's not a normal we should want to go back to. So I think my hope is that in 30 years, when I talk to my kids about this period in time, what happened starting in, February, March of 2020, it's when we reconciled all the wrongs that had plagued us from the very beginning of the inception of this republic. So that's my hope.
I agree.
I will say the thing that I will be able to say, outside of, talking about what I've done professionally for the community, the still quiet moment that I would hear the birds sing and just pause.
Mm-hmm.
So even as busy as I have been, those things have been just wonderful to me. Those moments when I could just sit on the back of my porch early in the morning and listen to the birds sing. And those are things, because we're so busy,
right?
We're always moving about. And the thing that I take away from a lot of my friends that are, that have small kids, I'm like you, my son is, 24. And so, but the ones that have small kids, they are, doing their education for them as well. This will be a bond, a stronger bond build with your children, because when you do shift back and you're away from your home a little more, your kids are going to say, I wish we could go for one of those walks that we used to do when we were working from home. Or I wish you could come home early and we could start them early when you were working from home. So cherish this time of still and quietness will be my thought.
I think that's a perfect way to send us all into the evening. My kids have been as patient as they intend to be, and so we got like a 10-second countdown before somebody knocks on this door. I want to thank all of y'all so much, not just for being here this evening, but for the contributions that you're making to our communities. It's so important, and we were really intentional about who we select to come and share with us and share with the community, because I just personally and professionally respect every single one of you so much and what you're doing so much. I know you're working hard and that you take this seriously and you have a true passion for service. And so thank you all very much for your service. And thank you, everybody in the audience, for joining us tonight. We'll be back next Wednesday and every Wednesday until we don't have new information to share with you regularly that we feel like you need to know as soon as we know it. So we'll see y'all again soon. Feel free to reach out if there's anything that didn't get answered. Like I said before, I'll take the opportunity to go back through and try to address any unanswered questions. And always put yourself, the health and wellness of yourself and your family first. And if there's anything that we as a municipality, as anybody who's on tonight, or the folks that will be joining us in the weeks to come can do to help you, never hesitate to reach out. Thank you, everybody.
Thank you.
Thank you.
Bye-bye.
Thank you.
Uh-oh. I think I'm still